Hello, and thank you for joining us today for the webinar, Data Matters, Leveraging Research to Inform and Evaluate Youth Needs in a Hotline Environment. I'm Jessica Boyd with Child Welfare Information Gateway, and we are pleased to have speakers from Childhelp and Southwest Interdisciplinary Research Center at Arizona State University with us today to discuss their partnership and hotline research. Before we begin, we have a few housekeeping items to go over. Next slide, please. So this webinar is being recorded. All attendees are currently on mute. If you have a question, please use the Q&A feature in the Zoom taskbar to submit your question. We will answer questions at the end of the session. If you're having a technical issue or need assistance, please put that in the chat and I will assist you. We also have closed captioning enabled for this webinar. To see captions, click on the CC button in the Zoom taskbar. And after today's webinar, the materials from the presentation will be sent out. And so to introduce our speakers, we have Dr. Wendy Wolfersteig. Dr. Wendy Wolfersteig serves as Director of Evaluation and Partner Contracts at the Southwest Interdisciplinary Research Center at ASU and as Research Associate Professor in the School of Social Work. For over 20 years, her work in substance abuse prevention and evaluation in Arizona has focused on the use of effective evidence-based strategies and data-driven decision-making. She leads her team in working collaboratively with state, county, city, and local agency and coalition partners to design and perform evaluations, provide trainings, and disseminate findings aimed at preventing, reducing, and eliminating health disparities. We also have Jody Hall. Jody Hall serves as the Program Manager for the Childhelp National Child Abuse Hotline, responsible for leading all aspects of grants, contracts, and data management. For over 25 years, she has dedicated her career to improving the lives of youth. She has 15 years with Childhelp and has worked in various roles, including Program Director for the Childhelp Community Center, focused on prevention of child abuse. Her previous work as a program administrator within local government sparked her interest in working with youth through experiences with Head Start and workforce development youth programs. Jody received her master's in public administration from Webster University and her bachelor's in criminal justice from Arizona State University. We're pleased to have both of them with us today. And now I'll hand it over to Jody Hall with Childhelp.
Thank you, Jessica. Wendy and I are pleased to be with all of you today to discuss why data matters. But first, before we get started, we wanted to make you aware that this project is supported by the Administration for Children and Families of the Department of Health and Human Services as part of a discretionary grant as indicated on this screen. And for those of you who were with us for the first webinar, you heard about Childhelp National Child Abuse Hotline. However, for those of you that were not able to join us, we wanted to kind of have a little bit of a recap of who we are. So the Childhelp National Child Abuse Hotline is the only nationwide hotline with a primary focus on child abuse and neglect. And we average over 100,000 contacts annually through calls, texts, and chats. The hotline is staffed by professional counselors who can provide services in English and Spanish 24/7, 365 days of the year, and have access to video relay services and over 170 languages through a language line service. The hotline provides information, education, crisis counseling, support, and referrals to community resources. It's important that we distinguish that we function as an independent from state child welfare agencies, which take and investigate the formal reports of suspected child abuse and neglect. Our hotline fills the gap and connects the dots. In some instances, we refer the help seekers to make a report to a state agency, but in many instances, the help seekers are looking for emotional support or to explore options they have based on their situation they are reaching out for help with. We also link to local community resources to ongoing support. Childhelp has long recognized the importance of partnering with academic researchers. As such, Childhelp first partnered with Arizona State University's Southwest Interdisciplinary Research Center in 2015 in order to evaluate the Childhelp Speak Up, Be Safe prevention curriculum. This curriculum is now rated a 2 by the California Evidence-Based Clearinghouse, which indicates the curriculum is supported by research evidence. Shortly after, in 2016, Childhelp engaged with ASU CERC to provide quantitative analysis of our Strengthening Families Parenting program. Seeing the benefits that academic community partnerships provide to enhance our programs, Childhelp continued to engage with ASU CERC to conduct quantitative research evaluation of the Prevent Abuse of Children Text and Chat Hotline project in 2018. The PACTEC project provided an opportunity to plan, implement, and research text and chat services in a hotline environment with a target population of 13 to 24-year-olds and a primary issue of child maltreatment. This population does not regularly access the hotline by phone. In fact, over 90% of callers reaching out to the hotline were adults reaching out on behalf of children. And this funding expanded the hotline's ability to connect with youth through text and chat modalities, which is their preferred method of communication. It also allowed us to again partner with ASU CERC to quantitatively research outcomes and best practices for serving youth. Implementing these modalities helped mitigate risk factors, increase protective factors, such as connecting youth to supportive services, stress reduction, and increased hopefulness. To be more specific, the quantitative research looked at the demographics of who was reaching out to the hotline, what the presenting issues were, and what the immediate post-contact outcomes were. And now with that, I'm going to turn it over to Wendy for a more in-depth look at the quantitative research process.
Thank you, Jody, and good morning, everyone. So again, I am Wendy Wolferstig at, you're hearing, Southwest Interdisciplinary Research Center, and from here on out, I will call it CIRC, S-I-R-C. Academics like long names, and so you can tell by that. We have been a research center at ASU for over 25 years. We are actually functionally in the School of Social Work, which is also in the College of Public Programs and Community Solutions. So you're hearing a lot of emphasis on working with community and on things that are very publicly oriented. Specifically, we look at issues around health equity and prevention and partner with those communities to look at the research and solutions to the issues and problems and concerns that we all have. Specifically, CIRC does community-based participatory research with different schools, organizations, agencies, and it can be at the federal level, state level, other higher ed institutions or departments of health that we work with, as well as local health provider organizations and coalitions. We help them look at their evidence-based interventions, whether they are developing these interventions, whether they are implementing them for youth and families, and looking at the degree to which their programming is effective, because we all want to be doing evidence-based and effective programming if we're spending the time and effort. We also then take a very data-driven research focus. With our research, we have faculty working on NIH research projects. We're actually funded by the National Institutes of Minority Health and Health Disparities, as well as our evaluation services, which are funded by local grants and contracts, often requiring many in the health professions to have an external evaluator, And thus there's the opportunity for us as a university center to step in and help the community agencies and partners with evaluation and other kinds of services around motivational interviewing, technical assistance, training, the communities that care model, and interpreting and looking at data. Next slide. So with that kind of background, all right, we are very interested in the evaluation design of projects. And when you're looking at the research or evaluation, you're asking the question of effectiveness. And so for PACTech, it was, if we're going to be implementing text and chat, how do we know that it's going to be effective? And what are the specific questions that we need to understand, research, and have data on to show that this is a worthwhile endeavor? So when we were really looking at it, we were talking about the degree to which the intervention was going to be effective. When you look at how to design all of this, develop it, and implement it, that's what it really did take us a while. And I'm going to walk briefly through those steps with you. But we also knew that the typical gold standard randomized controlled trial was not going to really be possible in this situation. We could not have a control group of youth or people who called, texted, or chatted, and we didn't answer their questions. That is not acceptable for a hotline. That's not what a hotline was going to do. So we came up with a way of looking at, can we at least have a comparison group so that we can see, compared to something else, how are text and chat doing as a mode of helping youth and others to look at getting their questions answered. And so we decided to use the calls, which had been happening for years and years and years, as our comparison group when we did the design for all of this. We also walked through many steps in developing this design, implementation, and evaluation so that we could really analyze what was happening in terms of our effectiveness. Next slide. So to begin with, we really then looked at what are the research questions, the framework by which we are going to investigate all of this after having, of course, done a literature review as well. So these are the questions that we determined we wanted to answer with all of this. What are the best practices and protocols for implementing text or chat-based technology for a hotline? The Administration for Children and Families was interested in how they were spending their money on this project, but also knowing that there were many other advisory boards and other hotlines that were currently implemented. How could they best also take steps to implement text and chat, and wanted to use this as a model for that? How effective is PACTech at communicating with youth who may be victims of maltreatment, and go ahead about protecting their privacy while doing so? Because again, these were new technologies that we were looking at. How effective is PACTech at engaging with youth to build their skills, provide resources, the information that they are looking for? What are the demographic characteristics and the presenting issues? Why and who are using text and chat? And finally, what are the best practices for the counselors who are answering the calls, texts, and chat on the hotline, for them to be able to use these technologies to work with the help seekers? So we set out to answer those questions and determined that in doing so, there were some things that we really did need to know up front about how all of this was going to operate. Designing is one thing, operationalizing is something else. And so we really decided that it was very important to do a pilot project, a pilot test of everything that we were going to put into place, because the counselors were new to text and chat. The systems that they were using behind the scenes were, in a sense, new to text and chat, and getting data into their systems, as we're trying to figure out for sure how to ask appropriate questions of the help seekers, what were going to be the language and reading levels. Most callers had been adults, and now we knew we were targeting the 13 to 24-year-old population. And open-ended, close-ended questions. We really wanted to have some time to sort through that by doing a pilot. So we did pilot data collection after we established our first system for all of this. Between February and July of 2019, analyzed the data, and then really learned some key factors in terms of doing this, like how people respond to answers. We originally had a Likert scale of different kinds of things, and discovered that that was not working well. People were not figuring out the difference between a lot, a little, and somewhat. So we ended up going to yes, no, and maybe. Much clearer, and especially for youth. We also had been wanting to find out where these youth and people live. And so we were asking for zip code, and that didn't work either. We really ended up going to just asking what state they were from. So we learned a lot about how to ask the questions just from doing this pilot, as well as the counselors learned how to respond when they could use some texts and chats that kind of been pre-written, but really needed to be tailored for each individual child by doing this pilot. So it was very, very worthwhile to make sure that we got the language, the reading levels, and all of that right, as well as the types of answers for each question by doing a pilot program. Finally then, next slide, we ended up looking at specifically things about our survey questions. Part of our issue with the technology was that the beginning, when someone signs on to text or chat, it was easier to have, with the way the system was designed, open-ended questions. We also made sure that people could opt out. But with having open-ended questions at the beginning and then close-ended questions at the end, it also made us really think about what were the important data we wanted up front on everyone who is going to sign in, compared to those who would choose to do the survey, the post-survey at the end, which we knew was not going to be everyone. You had to at least go through the questions at the beginning, although again, you could opt out. And then we really had to look at the sections and how we were going to analyze those data to really help us get to the evaluation outcomes. And we really did want to look at those kinds of things. And so specifically then, next slide, our beginning questions, which again, because of the system had to be open-ended, were how did you hear about this chat? How did you hear about the chat hotline or the text hotline? And then you could just write in your answer or prefer not to answer. How old were you? This again was key because we had the hypothesis that younger people would do more text and chatting, and we really wanted to know that for sure. We also asked about gender and asked people, gave them some options of boy or girl and how do you self-identify or prefer not to answer. But again, people could write that in. And then what state are you chatting or texting from? Also, so you know that youth do have to consent at the beginning. The lawyers at Childhelp were very involved in helping to make sure that all of this was done with all of those kinds of legal issues considered as we went through it. So this is what happens before you actually get to someone to text and chat with. You're put in the queue and answered almost immediately with text and chat in terms of the counselor then getting on the text or chat with you. Those are the beginning questions. At the end are post-survey questions. Next slide. we had a different piece of a system working with those. And so we could do questions that were what are called the close-ended questions. We provided the responses for these. And here we again ordered them so that the first several questions are answered with a lot, a little, not at all, prefer not to answer. And then the next several are yes, no, and maybe. This really goes to answering those research questions. Did you feel more positive or hopeful after this text session? That was certainly a goal of calling the hotline or chatting with the hotline or texting the hotline. Did you get the information you needed? Do you feel better prepared to deal with the situation, whatever your situation is, after this text session? Do you feel less stress? Was using text or chat a good way for you to get help? Would you have called the Childhelp National Child Abuse Hotline if text or chat was not available? Have you reached out to us before? And then the very last question, because we know that sometimes it puts people off, was about answering your race or ethnicity. Again, with all of these post-survey questions, people could decide not to answer and move on. We've had very good response to post-survey questions, and our data is on the next slide. So here we go. I'll start over here on the right-hand side with the text, chat, and call post-survey response. We consider these to be great features of all of those who are text, chatting, and calling. These are the response rates. So we've had an average of about 30% of people answer the surveys at the end, stay on, and provide their information at the end. Those are wonderful numbers, at least the way we look at it. Most market research is happy with a 5 to 8% response rate. Also, we learned that texting and chatting takes longer. There's more of an interaction going on in terms of everybody having to type in what they're doing, and that takes longer than a call. So getting the counselors to be able to do these kinds of interactions, going back and forth and spending almost 3 times as long on their texts or chat, was also something that really had to be learned, a learned behavior by the counselors. And so these are actually now from the 12-month study. As I said, we did the pilot, learned what we needed to do, and the 12-month study was from June 2020 to May 2021. This was also a time in which everything, all of the people calling, texting, and chatting into the hotline really picked up. Again, June 2020, everyone was at home for COVID. And so this was we felt that this was really performing a service for those young people who were now at home, didn't have access to their school counselors and other people. And so that very much reflected what was going on at the time with all of that. And indeed, we found that on average, the youth who were texting were about 15 and a half years old, as were the people chatting, whereas the average age for the callers was more like 17 during this period of time. The other important piece on this slide is would you have called, texted, or chatted if what you did was not available? And what we see is that people who called were much more likely to say that they would also have text or chatted, versus those who texted or chatted were less likely to have called. This very much told us that having that text and chat option was so very important to these young people. Next slide. Other answers to questions. Did you feel less stress after the call, text, or chat? Again, relatively comparatively good numbers in terms of responses. 73, 75, 85%. Did you get the information you needed? Wow, yeah, most people did. This was wonderful for us to be able to see these kinds of results, that the hotline and these services were providing a very needed service to the help seekers. Next slide. And this goes on now to show, do you feel you were better prepared to deal after this, with your situation after this text, chat, or call? Call percentages have always been high, but to be at 80%, even on maybes or yes with text or chat in its first year, was very positive as far as we were concerned, as was youth, 85, 87, 88% feeling more positive or hopeful after having this interaction with the counselor. So these are the results from the comparison study of text, chat, and calling. We have felt very good about those and very much determined that this was an effective way of doing business, and especially of reaching the 13 to 24-year-olds. The other thing that we have done over the years is qualitative data collection with the counselors, because it's the counselors who make it happen. And Jody's going to pick up a little bit at the end here about other things that have been done to really help and strengthen the counselors and the climate. But we knew that working with the counselors and the work they were doing was so very important that internally, prioritizing the mental health and a trauma-informed culture was going to be necessary, especially after COVID picked up and everything became more traumatic. And understanding how the counselors' well-being really did impact their performance. And they had always communicated well with each other and with their supervisors, but being able to promote that, and especially in a remote situation where no one was in an office and could really communicate by looking over at the next person or walking to a supervisor, but everyone was remote and had to figure out that system for communicating with each other and being able to be retained in their positions. Next slide. We have done focus groups in 4 of the 5 years that they've had this PACTEC grant. We've done 8 focus groups over those 4 years of time period, over the 5 years, to really look at things like vicarious resilience, vicarious trauma, and other issues, and to figure out and know for sure what issues were going on. In 2019, we did 1 focus group with counselors and supervisors. In 2020, we determined that it was going to be probably a little more helpful to our data and to the people in the group if we split the counselors from the supervisors. So that year we did 2 groups. In 2021, we did 3 focus groups. We had new counselors who'd been there for a while, and then supervisors. And this year we did another group of counselors and supervisors. In 2019, the findings, the themes that came out from our findings were helping youth, safety, trust and privacy, and text and chat skills that were needed. In 2020, the 2 focus groups, the themes that came out from those focus groups were empowerment, supervision, and to no one's surprise, COVID challenges. In 2021, the themes that came out from our findings were vicarious trauma and vicarious resiliency, mental health coaching, and providing systems and support. And this last year in March, when we did focus groups, the themes that emerged from those were impact, challenges, and training and development that were still needed. Next slide. So a few highlights. We could go on and on with highlights from what the counselors and supervisors said that were so enlightening of what their jobs were, of how they feel that they are being helpful. So we've just picked a few examples here. For example, One counselor said, I had one texter just a couple of nights ago tell me that they've carried their story around for years. And this was the first time they ever told someone that their story, because it was easier on text. Wow, powerful. Next slide. Another counselor said, I think texting is what teens and kids now have grown up with. And I think that we've opened up a whole new population of kids who are reaching out because now we have text and chat available at the hotline. Next slide. Further, on the issue of safety and safe spaces and providing those, one counselor said, many people who reach out to us don't have anyone or don't feel comfortable, being their true selves or feeling all their feelings of what they're going through. And we have the opportunity to hold space for them, to listen and validate, and we can be there for them. And I think that's really special. And we know that thinking it's special is what keeps counselors on the hotline, keeps people retained in their jobs and feeling that sense of resiliency when they're being helpers in these kinds of professions. Next slide. So I'm going to want to refer you also to our websites. The Childhelp website, as shown right here, has many different pages with research. And we have been able to provide the research in many different ways to try and be helpful and reach different audiences. So one of the things that we have done are a series of briefs that are either 2 or 4 pagers, briefly outlining exactly what we did and what the results were. So there are briefs from each of these focus groups that are available. Other things that are available under the research tabs on the Childhelp helpline pages and research pages and the CERC pages are also all of our reports with the research data from the pilot, from the comparison study, from all of the other pieces that we've done, the model that Childhelp has developed. And so these are wonderful resources for you all to be able to do as well as things like this webinar that we have really tried to put out there. Jody's going to tell you about a journal article. So we've tried to provide the information of what we've learned, how things were done and conceived, so that all of this is out there for you to use to be able to help you in what you're doing. So I hope some of these data have stuck with you today. And with that, I'm going to pass it off to Jody to talk a little bit more about all of the data planning and pieces that are still going on. Thank you.
Thank you, Wendy. So now we're going to get into a data plan, data management, as well as data collection. And a plan is important to increase the credibility of your program. It also informs operational dashboards and external visualizations, advances the sustainability of program outcomes. Not only do I serve as a data manager, but through my introduction, you also heard that I am in charge of grants and contracts and managing all of those for the National Hotline. And that affords me a unique position to tell our story using the richness of the data that we've collected on our hotline to be able to continue to fund programs and projects like this. So it also improves our operational efficiency and leads to data-informed programmatic decision-making. Second, it is important to define the variables and information to collect in order to assess services and build evidence-informed practices. Data collection should be clear and consistent. Training is a key component and should include a standardized data collection elements on your contact record, development of a data dictionary to show a clear definition and understanding of what variables are being captured, understanding of the reason for data collection. But it also is important for data fidelity and an established plan of how it will be reviewed and analyzed is critical. And this also includes routinely reviewing your text and chat transcripts to ensure accuracy of variables being entered onto the contact record. You need to tie data collection into the evaluation and supervision process to ensure it remains a priority and support is given as needed. And we need to establish a plan to roll out data collection changes. It's important to note that keeping a historical record of when changes occur and the reason that they've occurred is a key lesson that we've learned. This is really to assist us with working with all of our research partners. And we have recorded a training on data collection so that all team members receive the information in the same manner. And it doesn't matter if staff are new to the organization or not, they all receive the same training by having had it recorded. And then community agency collaborations with academic researchers leads to evidence-informed practices. This allows our program to enhancements to be made to best meet the needs of those seeking help. It also leads to a robust outcome analytics. This type of partnership is an investment in time, resources, and finances, but it has many benefits, including objective evaluation of your services, co-creation of evidence-informed program practice models developed through an interactive process, and alignment of your mission-driven individuals with unique areas of expertise informing the process. This ensures that it's based in a solid evaluation practice while still being practical for program services. Ability to have comprehensive data analysis to understand who is utilizing the services, as well as outcome performance. Telling our story through data has led us to other opportunities with additional universities, including the University of Pennsylvania. So as Wendy has stated on our research page, we do have a number of research papers that have been developed, topical briefs, our research findings, as well as all of the other research. And so the University of Pennsylvania project was a study on the effects of COVID on child maltreatment. Just a year into the process of implementing text and chat services, COVID-19 hit. As students were sent home from schools, our counselors were sent home to work remotely and saw an increased demand of text and chat services, especially from youth seeking support during this difficult time. Because of our existing framework and collaboration with researchers, we were quickly able to adapt to not only support those reaching out for help, but also in data collection to understand the issue people were facing in real time. The Childhelp National Child Abuse Hotline has been the focus of 3 publications, published journal articles, and continues to work with universities on additional professional journal articles focused on the work of the hotline. And we're very proud of that. One of the lessons that we've learned over the past 5 years is the importance of the sustainability of the project. You know, all projects and their funding will eventually end, but we wanted to make sure that we could sustain the project beyond any funding. And so for the last 5 years, in addition to learning about the importance of academic partnerships, was that in order to grow and continue meeting the needs of help seekers, we needed a process for our data management to be an internal function. So in early 2021, ASU CERG began training the internal Childhelp team on the process of data collection and maintaining the fidelity of our data. Within 6 months, Childhelp officially brought that data management function in-house, and now not only continues to support the quantitative research of ASU CERG, but has been able to expand our ability to partner with additional academic researchers to ensure data-informed programmatic decision-making. The a data dashboard has been maintained over the past 4 years through Microsoft Excel for PAC-Tech. But hotlines collect a lot of data and a lot of rich data. And so what we found is that Microsoft Excel is a bit old school, and it's not necessarily the best platform for maintaining a large volume of data. So this past year, in collaboration with our HHS technical assistants, JBA, Childhelp embarked on transitioning all data for this project to Microsoft Power BI. And this will be able to maintain our dashboard. It will allow us to analyze the data collected, not only from a historical lens, but look forward in real time. And these are just a couple of samples of what we've been able to do within our Power BI and continue to look at moving forward. So collaboration between academic and community agencies is vital in creating high quality and sustainable programs that prioritize the needs of those they serve. And some of the lessons that we've learned in our experience highlight the promise of academic community partnerships for improving child-related services. Each team made time, space, and intentionally met regularly. And as Wendy stated, we piloted all of the instruments and we untangled new opportunities to deliver high-quality services. The team developed a data management plan to build and establish rigorous evidence to assess whether text and chat services are effective in delivering support services. This contributes to the sustainability of continued evaluation and improvement. And as we progressed further along in the research, we found there was also so much value in the transcripts themselves, specifically looking at how youth felt most supported through text and chat interactions, which led us to develop a best practice model for working through the stages of a text and chat interaction with youth. We're also examining the core competencies required by our counselors to successfully interact with youth through these modalities. As we know, text and chat takes away the inflection of your voice. It has a little bit of a different feel to it for our youth. And so we needed to make sure that our counselors are able to interact appropriately through written. And so session 3 of this webinar series will dive deeper into that qualitative research. And we hope that you'll be able to join us for that session on August 23rd. And with that, thank you for attending this webinar today. We hope that you enjoyed the presentation. As mentioned earlier, this recorded webinar will be posted on the ACF YouTube page. And this concludes our webinar. Now we will open it up for questions. And if you would like to contact Wendy or myself, our contact information is on this slide. But for now, let's go to Q&A. So Jessica, do we have any questions?
Yes, we have several. So the first question that we got, why were open questions chosen for the first survey versus closed?
Boy, that's an interesting, good question. And I'm actually going to put it back to Jody here in a minute, but actually it had to do with the technology and the systems more than how we really wanted to do it. Of course, we know that it's always easier to do close-ended questions. Here's your list, pick your list. But the beginning of the system where the consent was going to be done did not allow for that. And so we decided to go ahead and ask a few questions up front. That had not necessarily been done in the past, but they needed to be open-ended questions. Also, of course, that takes some additional data cleaning on our end, but with us, Jody and others, we've managed to figure that out, but it really was a technology question, and then a different system was built into the back. Jody, you know more about the technology. If you wanted to add something.
No, I think you said it perfectly. It really was. It was about what can our technology handle, and there were different aspects for what could happen at the beginning of a contact versus after a contact had concluded. And so at the beginning, like Wendy stated, that particular platform that we were using would not allow us to do close-ended questions. But we also, as a benefit, doing the open-ended, have found it can go both ways. You can get disclosures because it is open-ended, so we have to be careful about that, which, like Wendy said, we have started to clean all of that data and have a really good system in place for how we go about doing that. And then, but you can also get additional information which will assist the counselor when they are supporting, because our counselors do see the answers to those questions. So it helps them in their engagement with the help seeker.
And in fact, that's why the age and the state question and some were put up front, was because that was the very, very helpful information for the counselor to know how old the person was that they were going to be texting or chatting with up front. So.
Okay. Were you able to analyze if the increased time in chat or text interactions was due to caseworker delays versus youth delays?
I don't think it was because of any delays. I think it was, we were getting a lot more information. The counselors were able to get the youth to provide them with a lot more information than if they had called. And it does take time to type out a paragraph versus to say it. And so that would be the only delays that we were finding. But really, I think that we were finding that we were getting a lot more of a rich conversation between a counselor and a youth when they were able to utilize the text and chat modalities.
Did you identify opportunities for decreasing that service time via text or chat?
I'm sorry, Jessica, can you repeat that question? I didn't catch the beginning of it.
Yes. So along with that previous question, did you identify opportunities for decreasing that service time via text or chat?
We didn't look at that high number as being a negative. And so we did not try to decrease that number. Other than what we did do was we came up with the practice model, which we will be discussing in session 3 of this series, and which would help the counselors along with being able to do closings. One of the things, the only thing I would say is that we did start to find sometimes there was some issues with doing a closing and ending a chat or conversation that did not just continue. And so our counselors, we were able to put together a practice model which helps to guide our counselors in how to do that appropriately, so that way you're not on a text or a chat for several hours versus 20 minutes. We certainly, after a period of time, the conversation is no longer productive, is one of the things that we did find. And so session 3 will really go into a lot more about how the counselors have been able to utilize a practice model to help guide the direction of the conversation, so that way it does not go on endlessly.
Let me also just really clarify that the times that you saw were the amount of time that the counselor is providing service. That is not the amount of time that it takes to get to the service.
Correct.
That's a very short amount of time to get to the service. Those times were the interaction times.
Yes, I would say that, and to add on to that, our times to get connected to a counselor, even though they were having to answer those 4 survey questions, was still less than a minute on average.
Great. And our next question, have you seen your overall rates of outreach to the hotline increase since implementing this new text chat option? How have rates of call outreach changed? And are the changes statistically significant?
We have continued to see the average number of contacts it increased during COVID. There was definitely a spike during COVID. It has now gone back down to what we typically would average. However, what has changed is that the number of youth reaching out has significantly increased. And so we're still seeing the same number of calls come in. However, now you've added in text and chat. So in some ways, our numbers have changed. I don't know, Wendy, if we've looked at, I'll pass that part off as far as statistics on it, and if we've completed that evaluation. But overall, I think that, you know, our numbers are pretty consistent. They are like any hotline. They will ebb and flow, and we will have spikes depending upon our outreach. One of the most effective outreaches that we have found with the youth is through social media. TikTok has been a great way for us to reach the youth, as well as Instagram. We have tried all of the platforms, and those seem to be the ones that most of the youth were finding us on. And then this past year, we've also started to do 30-second videos on the Disney platform, so ESPN, Disney, Hulu, and that has also shown that we would have a spike of texts and chats during those campaigns. So on average, I would say that we have maintained. It's just that the demographics have changed, as well as the how they're contacting us has changed.
And I believe you may have touched on this with the previous question, but how do callers find out about your hotline, and how many are return callers?
We have those numbers as far as return callers. I don't have it off the top of my head to be able to tell you today. We can get that number. But yes, through social media, that is our number one way that we have been doing outreach, as well as dissemination to professionals. We have other Childhelp programs that anytime that those programs are out in the community, we not only speak about the national hotline, we speak about our other programs, and those programs do the same in kind. And so we've been able to get the word out that way. But a lot of it is through social media and just marketing outreach.
Great. And I believe this is related to the survey component, but the question is, would SurveyMonkey work?
Jody, even you know the answer to this. SurveyMonkey is not as complicated behind the scenes. So it would seem to be able to do that kind of thing, but what's being used are much more improved, higher level technologies to really be able to collect the data, to interact with the call features, the technology that's being used there. And so, whereas in theory, SurveyMonkey would work, it would not at all be ideal for collecting the data the way it's being interacted with the technology, nor for how the data are being then put into the database, the data platform, the dashboard. And you can elaborate on all of that, Jody.
Yeah, because we do some web surveys. So we use SurveyMonkey for some of our surveys, but they're all for our website surveys. Anything that we are doing as far as research for evidence-informed decision-making, we have found that we need to be able to get in. The other thing that we have to be able to clean out, because of our pre-survey questions are open-ended, you do get disclosures. And so SurveyMonkey is also not the most secure to ensure that we would be able to de-identify. And so the programs that we use internally and the platforms that we are using to collect the data have all met those requirements to maintain confidentiality of any of our data information. So prior to us sending any data to a researcher, we establish a data share agreement in which we have to make sure that the platforms that we are using between each other are secure, but also it gives us an opportunity internally to go through and de-identify any data, because we certainly do not want any leaks of personal identifying information. We are, as Childhelp, we are, and all of our researchers are under the auspices of HIPAA. So we do take that very seriously, and I just don't feel that SurveyMonkey would be the best platform to ensure that all of that occurs.
If I may, I'm going to go back real quickly to the question about people having contacted the hotline before. During the comparison study, 77% of callers had not called before, 79% of chatters had not called before, and 86% of texters had not texted, chatted, or called before, or reached out to the hotline before. So most of these were new people, but anywhere in the about 15 to 20% are repeat customers.
Thank you, Wendy.
Okay, our next question is, why did you all choose Microsoft BI over other systems and platforms?
That was a Childhelp internal decision. Our internal IT department, all of our platforms that we use are Microsoft products, and so it was the platform that would integrate with all of our existing systems, as well as already meet all of our security requirements. And so we did look at others. We looked at Tableau. We looked at continuing with Excel, and we also looked at the platforms that we use to collect the data. And see if they would be able to provide us with dashboards. And it was just determined internally that Microsoft BI would be the best fit for us as an organization.
Okay, and there seems to be a huge difference in participation of white youth versus BIPOC youth. Have you looked to see if the level of satisfaction differ by race? And we did get one response from Michelle Fingerman at Childhelp, who said, we are actually looking at that exact issue this quarter. And we also have a web survey currently in which we will be looking at differences by race. Is there anything that you'd like to add to that?
No, I think she said it perfectly. That's exactly what I would have said.
Great. And our last question is, what platform do you recommend other than SurveyMonkey? I know, of course, you can't endorse any specific platform, but any recommendations of platforms users can check out?
Well, what I will tell you is that what Childhelp utilizes is Nice in Contact. That is the platform that we are using in order to connect with all of our help seekers, and they also provide us with those pre and post surveys connections. Any other platforms? I mean, there's a lot of them out there. I think what really needs to what would be really important is to figure out what works best within your organization. I mean, Michelle and I, Michelle Fingerman, who's the vice president of our national programs, we spent 3 years going through various platforms. We beta tested over and over again. We brought in our internal IT department to make sure that things could meet, the security profiles that we needed it to meet. It was a real team effort. And, we brought in including, you know, our research partners, you know, to make sure that we would be able to do pre and post surveys through any of the platforms that we chose to use. And so it was a real team effort, and it was several years. So when we started this project, within a year, we realized that we needed to start looking and making sure and really evaluating and assessing whether or not the platforms that we were using for telephone were the best platforms for text and chat. And so then started us going out and beta testing multiple systems. So I think really it just depends upon what best fits within your organization, because I don't think that there is a one size fits all for any hotline.
Great. Well, we are at time, so I'd like to thank everyone for attending the webinar today. As Jody mentioned earlier, the presentation materials will be sent out after the webinar, and this recording will be posted on the ACF YouTube page. We also invite you to take a moment to provide us your feedback by taking the survey. The link is provided in the chat box. But thank you all very much, and this concludes our webinar. Thank you.
Thank you.
Thank you.